Thank you for watching. This is YouTuber Medical University. Suddenly, everyone, how would you feel if I told you that your blood sugar level could change significantly just by the way you choose and drink your beverages? There is a famous study. In one group, participants ate donuts while drinking 250 milliliters of water, and in another group, participants drank water 30 minutes before eating the donuts. And the last group ate donuts without drinking any water. So, which group do you think had the highest increase in blood sugar after eating? Actually, the group that drank 250 milliliters of water together with their meal had the highest blood sugar levels. That's what was reported. Eating the donut with water likely made it easier to absorb, causing blood sugar to rise more quickly. On the other hand, if you drink water 30 minutes beforehand, the rise in blood sugar can be suppressed. Even though you consume the same amount of calories, the way you drink actually changes how your blood sugar rises. However, you can't just avoid drinking water altogether, even for those without diabetes. When your blood sugar rises, it's called a blood sugar spike, where your blood sugar rapidly increases and then drops quickly. There are actually reports that this can accelerate arteriosclerosis. When that happens, your blood vessels are damaged, raising your risk of serious diseases like stroke or heart attack. To live vibrantly later in life, it's important to keep blood sugar changes as gentle as possible. However, there are also people who are making efforts in the wrong way like this. For example, some say, I drink 2 liters of water daily for my health, or I avoid coffee and tea. It's great to focus on your health daily, but it can be an issue if you're doing it incorrectly. In this video, I'll explain how to choose drinks to avoid blood sugar spikes. Later, I'll address whether drinking 2 liters of water a day is necessary and discuss green tea. Is it true coffee isn't counted as fluid intake due to its caffeine's diuretic effect? I'll also discuss such common beliefs. I'd like to scientifically answer these myths from a doctor's perspective. When you drink fluids depends on whether you have the right knowledge or not. It's free, so get informed and protect your health. Now, here's today's agenda. In the first session, I'll introduce the most effective eating and drinking techniques to prevent blood sugar spikes. In the second session, we'll discuss if common beliefs about hydration are true or false, such as the idea that you need to drink 2 liters of water a day or that caffeine is bad for you. I want to scientifically examine these beliefs. So first, in the first session, I'll introduce 2 practical techniques to prevent blood sugar spikes, and one thing you should definitely avoid. I'll also talk about how you can self-check if you're getting enough fluids in the second half of the first session, so please stay tuned. Here's the first technique for eating and drinking to prevent blood sugar spikes. Drink 500 milliliters of water 30 minutes before a meal. This was also shown in the donut study I mentioned earlier. As I mentioned earlier, it's recently been found that taking in fluids before meals is important. This not only helps slow the rise in blood sugar, but it's also said to be an important technique for preventing overeating and ultimately managing your weight. There was a study conducted in America in 2008. The group that drank 500 milliliters of water 30 minutes before a meal had about 13% lower calorie intake compared to the group that didn't drink water. And in another study conducted in 2010, in that study as well, in addition to a low-calorie diet, participants were also asked to drink water before meals. Those who drank water before meals and ate a low-calorie diet lost about 44% more weight in 12 weeks than those who only followed the diet. That was the result. The method was actually to drink the equivalent of 1 bottle of water about 30 minutes before each meal. The reason is simple, right? By drinking water first you feel full and naturally you end up eating less. You might think it's fine to drink water during your meal, but as I mentioned earlier with the donut experiment, if you consume a large amount of food and water together, it can actually increase absorption efficiency and trigger a blood sugar spike. So after all, it's best to understand that you should drink water about 30 minutes before your meal. It's said that if you eat and drink together, the food can pass quickly through your stomach and reach your small intestine rapidly, causing a sudden spike in blood sugar. So please keep this in mind. Of course, you need to be careful. If you have a heart condition, drinking too much water can lead to swelling and may even worsen your symptoms. For thin people, drinking too much water and not eating enough can actually lead to further weight loss and a decrease in physical strength. If you have any concerns, I recommend consulting your primary doctor or your regular hospital. Techniques for eating and drinking to prevent blood sugar spikes. The second one is the order in which you eat. This isn't about drinks, but still, to control blood sugar spikes, it's very important to first drink some fluids and then pay attention to the order in which you eat your main meal. To get straight to the point, please be mindful of eating like this. The first is veggie first, and the second is carbs last. What this means is that you start by eating vegetables and make sure to eat carbs or carbohydrates last. Even in a course meal, rice is served at the end, right? This might actually make sense. Some of you might be wondering if something like this can really make a difference. There's a study about this. According to research conducted in 2015 with diabetic patients, they had meals where they ate carbohydrates first. There was a group that ate vegetables and protein first, and then ate carbohydrates 15 minutes later. Even though both groups had meals with exactly the same calories and nutrients, the group that ate vegetables and protein first had post-meal blood sugar about 29% lower at 30 minutes and 37% lower at 60 minutes. This group had the lower blood sugar levels. That's an amazing result, isn't it? Simply changing the order you eat without medication can affect your blood sugar rise. Why does something like this happen? It's easier to remember if you also keep the reason in mind. By consuming vegetables and fats first, our bodies secrete a hormone called incretin, which makes it easier to lower blood sugar levels. And furthermore, it's said that if there's a base of vegetables in your stomach or intestines, even if carbohydrates come in afterward, their absorption tends to be more gradual. I know that, but I still want to eat my side dishes with rice. If you feel that way, know everyone else does too. You don't need to be perfect, so please, start by eating vegetables, even just a bite, then have your side dishes. Just by changing one habit like that, your future will surely change. Preventing rapid blood sugar spikes also boosts mental clarity. You'll be less sleepy and can focus on work or chores more easily. When you start seeing these kinds of results, you feel more motivated to keep going and you think, if that's the case, I'll try even harder. Your habits will start to change as you try to get your nutrients from vegetables and proteins, so even if it's just a bite, please try to make that change. For example, you can put salad chicken or an egg on top of your vegetables. If you're worried about salt, you can prepare miso soup with plenty of vegetables and eat the vegetables in the soup first. Please try to come up with your own original method. Now let's discuss what not to do. Some people visit my clinic believing they're staying hydrated, but they drink sports drinks every day. Please be careful about this. Recently, due to global warming, we've been having a lot of hot days. We're often told at hospitals and on television to be careful about heat stroke. There was a patient who made it a habit to drink sports drinks every day. Let me be clear. Think of sports drinks as liquid candy. When you drink this, you should recognize it as if you've eaten candy. A typical 500 milliliter sports drink contains about 30 grams of sugar. In terms of sugar cubes, that's about 8 sugar cubes. And since it's a liquid, your body absorbs it faster than eating sweets directly. It's said that your blood sugar level can spike more easily. That means it's actually much more harmful in terms of blood sugar, of course, if you catch a cold. When dehydrated after sports or heat stroke or in any situation with dehydration, or when you can't get energy from food, in those situations, sports drinks can be a strong ally, but constantly drinking sports drinks to avoid dehydration all the time can be a bit dangerous, so please be careful. For hydration, choose calorie-free options like water, tea or sparkling water. And when you sweat or are likely to become dehydrated, drink sports drinks. It's important to use them differently depending on the situation, so please remember that. In fact, when I asked my outpatient patients to stop drinking sports drinks and switch to water, their blood sugar levels dropped dramatically and they were surprised. That's how much sports drinks and juice can raise your blood sugar, so please be careful. Up to this point, I've talked about preventing blood sugar spikes by drinking water 30 minutes before meals, eating vegetables first and carbs last, and even when hydrating, being careful with sports drinks and juice. I mentioned that you should only rely on sports drinks when dehydration is suspected. In outpatient clinics, I often hear that people aren't sure if they have hidden dehydration or are actually dehydrated. There are also people who want to know exactly how much fluid they need in a day. For those people, one thing I'd like you to know is to check the color of your urine. Our bodies need oxygen and food to survive, and during metabolism, we produce water, known as metabolic water. The amount of metabolic water varies between individuals, and while we release water through urine, there's also something called insensible perspiration, which is water that evaporates from our bodies without us noticing. This also depends on daily temperature and humidity, so not everyone needs to drink 2 liters of water a day. There's no such rule. The amount of water you need changes depending on the person and the environment that day. As a guideline, the color of your urine is said to be most closely related to dehydration. It's simple. If your urine is almost clear or a pale lemon color, that's proof that you're well hydrated. Your current water intake should be fine. On the other hand, if your urine is very yellow or close to an amber color, that's a sign that your body is becoming dehydrated. Be sure to drink plenty of fluids and stay hydrated. If this state of dehydration continues, the amount of urine your body produces will decrease significantly. I haven't gone to the bathroom at all during the day today. That kind of thing can also be a sign to suspect dehydration. And if urine isn't being produced regularly, bacteria can get into the urethra, and from there, bacteria can settle in the bladder or kidneys, making it easier to develop infections. This is what's known as cystitis or pyelonephritis. You may feel pain when urinating or get a fever when this occurs. You may need to take antibiotics. To avoid this and to take care of your kidneys, it's very important to keep your urine a light yellow color. Please make it a habit to check the color of your urine after you use the restroom. I think it's very important to check whether you're getting enough fluids by looking at the color of your urine. At YouTube Medical University, as a practicing doctor, I discuss topics rarely covered in regular consultations. I share key medical knowledge. Having at least one reliable information source is essential. I'd really appreciate it if you could subscribe to the channel before you forget which one it is. I basically gave the answer in the second period, but is it really true you should drink 2 liters of water a day? And what about caffeine? Is it really true that green tea doesn't count as hydration because it has a diuretic effect? I'd like to scientifically examine these topics. You often hear that it's better to drink water at room temperature and things like that, right? Is this really true? Many of you probably think it's good for you. What if your healthy habits are actually mistakes? Let's reconsider those common beliefs. Here's the first of 3 big hydration misconceptions. It's the idea that you should drink 2 liters of water a day. You've probably heard somewhere that you should drink 2 liters of water every day, right? To get straight to the point, there's no real basis for that. Even when compared with reliable data from the American Institute of Medicine, there's no requirement that you must drink exactly 2 liters of water as drinking water. There doesn't seem to be any basis for that. As I mentioned earlier, we produce metabolic water in our bodies, and we also get fluids from things like vegetables, soup, and rice. When you add all of these together, even without counting drinking water, we're actually taking in a considerable amount of fluids. So what's important is to check things like the color of your urine or whether you feel thirsty, as I mentioned earlier. It's about self-care. Don't ignore those sensations. It varies with daily temperature and humidity, so please take care of yourself. Stay hydrated and listen to your body's needs. It's important. It's comforting to get simple advice like drink 1 liter a day or drink 2 liters a day, isn't it? But such easy to understand information is often wrong, so it might get a bit complicated, but here at YouTube Medical University we always show you the data specifically. The second of the 3 major misconceptions about hydration is the common belief that caffeine doesn't count as hydration. There are many healthcare professionals who mistakenly say this. Recent studies have shown that in moderate amounts, drinks containing caffeine can be counted as hydration just like water. For example, in a crossover study conducted on adult men, they compared the 24-hour urine volume, blood sodium concentration, and changes in body weight after drinking water, coffee, or tea, and concluded that there were no significant differences. In addition, a 2014 study observed 50 regular coffee drinkers, comparing times when they drank coffee with times they only had water. No differences in body weight, blood, or urine values were found between the periods. In other words, it was found that for people who habitually drink coffee, coffee can be just as effective as water for hydration. Of course, that doesn't mean if you ask whether it's okay to chug coffee, that's not good. European safety agencies have set a limit of 400 milligrams of caffeine per day. For coffee, that's about 3 to 4 mugs. A small can of coffee contains about 100 milligrams of caffeine. Claiming you'll get dehydrated from its diuretic effect is somewhat exaggerated. Of course, after drinking coffee, the diuretic effect does make you urinate more easily, but in the end your body adjusts the fluids, so it's currently believed that drinking coffee is no different from hydrating with other drinks. I've actually had patients like this in my clinic. Television reported that caffeine doesn't hydrate you, so if you drink caffeine, you should also drink an equal amount of water. That patient was a woman in her 70s who loved coffee, and she made sure to drink the same amount of water as the coffee she had. She had to use the bathroom more often, couldn't sleep well, and felt so full she lost her appetite, leading to weight loss, the opposite of her goal. I told her it's fine to enjoy coffee, but she shouldn't worry too much about drinking water and should focus on eating proper meals. She believed a common misconception, moving further from good health. Things like that can happen. So if you have any questions about common beliefs, please let me know in the comments section. Be careful, while caffeine is good, drinks like cafe lattes or energy drinks have a lot of calories. In terms of blood sugar levels, you need to be careful, so if possible, choose options that don't contain calories. It's important for your blood sugar to choose unsweetened tea or black coffee. Here is the third major misconception about hydration. Room temperature water is best for hydration because it's gentle on the body. I don't think you need to be overly concerned about this either. There is no scientific proof that cold water is harmful. You can choose based on preference. In fact, Japan's Ministry of the Environment notes that cold water, 5 to 15 degrees Celsius, is more effective after exercise or in hot weather as it's absorbed faster and helps cool your body. If you want your body to absorb it faster, slightly colder than room temperature water is better. So, there are cases like this. And you don't have to believe that it absolutely has to be room temperature. If you actually want to drink cold water, you don't need to force yourself to hold back. Please try not to do things like that. It's the same with drinking warm water. Of course, it's important not to let your body get cold, so drinking warm water to warm up is fine. But it's not like warm water is some kind of miracle cure or that everything will get better just by drinking it. So I think it's better not to have excessive expectations. And recently, there has been a trend of drinking warm water and other warm beverages. But as a doctor, what I honestly want to say is that rather than worrying about the temperature of the water, shouldn't we focus on how much water we're actually drinking? This was true for me as well. I thought I was drinking water regularly, but when I actually wrote it down and measured it, I found that I wasn't even getting 1 liter of fluids a day. And when I measured how often I urinated, it turned out to be extremely infrequent. It's a little embarrassing, but many people just assume they're drinking enough. When I asked patients who were struggling with unstable blood sugar levels how much fluid they were actually taking in, many of them said they were drinking quite a lot. But when I asked them to keep a diary of their fluid intake, it turned out they weren't even getting 500 milliliters a day. That's about 2 cups. They thought they were drinking frequently, but the actual amount was nowhere near enough. There's often a big gap between how much you think you drink and how much you really do. There's a gap, so I recommend being mindful and keeping a diary or something similar. How was it? In this video, I explained that for blood sugar, it's better to drink fluids before meals, not during, and that both veggie first and carb last matter. I also mentioned sports drinks and juices are essentially liquid sweets. The main indicator of whether you're getting enough fluids is the color of your urine. I also scientifically examined 3 major misconceptions about hydration. The idea that you need to drink 2 liters a day, that caffeine doesn't count as hydration, and that water should be at room temperature. If you learned something new, please hit the like button. I'd also be really happy if you leave a comment about anything that surprised you or that you want to remember. And I'm aiming for 1 million subscribers on the YouTube Medical University channel. I'd really appreciate it if you subscribe to the channel so you don't miss any new videos. See you in the next video.